This is a very special and unique community where kids who struggle with serious psychological issues live together, learn together, and play together. It's where the lives of these children and youth are changed and often saved.
The Child Study and Treatment Center is a children's psychiatric hospital in the state of Washington.
The patients are kids that have homes, kids that don't have homes, kids that have parents, kids that have adoptive parents, kids that don't have any.
We've got these kids who've tried it all and they need something more intensive.
Located on a spacious campus in Lakewood, Washington, the Child Study and Treatment Center, CSTC, operates within the Department of Social and Health Services and is the only state-operated and funded psychiatric hospital in Washington for children and youth.
We follow the mission of DSHS, which is transforming lives. Our number one goal is to provide a treatment plan that will help them learn about themselves and help them transition back home and thrive in that environment.
We serve the most complicated and challenged kids, 5 to 18 years of age, who have psychiatric disorders that can't be treated in their community.
They come from a place where the child is desperate to get their needs met.
So they've done the emergency room placements. They've probably tried different facilities.
Their previous strategies were not effective, and they currently were, they previously were really struggling with how to be able to safely exist in their community.
These children, who have exhausted every other community resource, are referred here by the Children's Long-Term Inpatient Program Administration, commonly known as CLIP. CLIP works closely with the family or guardian and local behavioral health and managed care organizations to screen and best determine the child's specific needs.
We're bringing these kids in and we're treating them and we're really making a difference in their lives. And that's a privilege. That's an honor.
The Child Study and Treatment Center campus is a safe, stable, professionally staffed, self-contained community for our patients. We have age-specific cottages where the patients live, an elementary, middle, and high school with certified teachers from the Clover Park School District, a gym, a playground, soccer and baseball fields, and all of the necessary administrative services. During their stay, an average of 6 to 9 months, patients live in one of the age-appropriate cottages where they have their own room that they can personalize to feel more like home.
For every cottage, you have a clinic director who is also a fully licensed doctorate psychologist. So you've got a full psychologist full-time for 14 kids. For that same group of 14 kids, you've got a social worker full-time. A full-time social worker just trying to family issues, family contacts, making sure they have all the support in the community, and also doing therapy. And then you probably, you have a nurse 24 hours a day. You've got, say 6 floor staff. It's phenomenal to me. The teams are phenomenal.
The cottages each have a kitchen, dining area where they share their meals with their cottage mates and staff, and a shared day area for various group activities and therapy sessions. The psychiatric treatment program is based on the most current evidence-based practices, including, but not limited to, cognitive behavioral therapy, dialectical behavioral therapy, and trauma-focused cognitive-based therapy. Parents and guardians are strongly encouraged to participate in the care and services provided. This helps lead to a greater success because when the patient returns home, everybody has a better understanding and new set of life skills to work with.
Days are generally pretty packed here. During the school week, they have school. They do go to a full day of school.
Our counselors and our nurses, they do an amazing job because they're there with them in the classroom, showing them, teaching them, and sometimes that's the first time that they've ever experienced success in an education setting.
And then we have generally recreation from 3:30 to 5. Then we have dinner at 5 o'clock. There's generally therapeutic groups or individual therapy occurring every single day. There's maybe a little bit more downtime on the weekends. Our recreation department also takes kids into the community, so they have recreation groups that go swimming or to various plays, the movies, different activities out in the community.
24 hours a day, 7 days a week, 365 days a year. Our patients are working with, being taught by, and cared for by an amazing team of professional, highly skilled, and passionate staff members. Nowhere else will you find a team like this that is so dedicated to helping patients find their success in life.
Everybody that works here wants to be here. They come here every day because they want to help these kids.
Hey, so how are you doing?